2 pushes, Mama. That's the way to do it.
Good morning. My name is Jenny. I've been a labor and delivery nurse for about 15 years now, and this is a day in the life of me, the charge nurse here at Chesapeake Regional L&D. Okay, first thing I do in the morning is I like to go to each side of my unit and I like to check my code cards because I like to be prepared for anything that could happen. So come on while we go down here to triage and get our code cards done. We have 3 code cards on our unit, and we have to make sure that everything is documented with when things expire on our unit and our code cards. And once we check all that, then we go on to the next one. Hey girls, do you guys need anything down here?
We're good.
You're good?
Thank you.
This is our like OBED side. So this is our OBER basically. So this is Courtney. She's one of our wonderful techs. This is Katie Lyle, who's one of our wonderful nurses. They're going to be holding it down here, and anything that comes through the door, they're going to hit this desk first. Hello. All right, Mama. Hey, girl. All right. So we're going to be doing the peanut ball, okay? So this is our mama. Mama, you want to introduce yourself?
Yes, I'm Sarah, and I'm having baby Ocean.
Yay!
Yes.
This is baby number 2.
Yes.
So we have noted that the baby is still pretty high, right?
Yeah, baby's at -2 stations.
So Bella, what do you think we need to do to bring this baby down?
Flying cowgirl.
All right, let's get you in that flying cowgirl. All right?
All right, we've just placed her in flying cowgirl position. She's got a peanut ball in between her knees with her feet pointed out behind her, and that kind of forward tilt to the pelvis helps baby's head come down.
Okay. All right, second code card done. This is our labor and delivery nurses station. This is where all of our labor nurses are and where all of our information for our patients are. So you'll come with me this way. We're gonna go to the Pyxis room. All right, this is the Pyxis room. So this is our medication machine where it puts out all of our meds for the day. I like to go in and just as charge nurse make sure there's no discrepancies or anything that I need to follow up on. And then back here we have our hemorrhage cart. So I always pull this out and just kind of do like a quick little run through just to make sure that I have all the supplies that I would need in case of an emergency with any of our moms for after they deliver, any bleeding. So it looks like I got it. Let me see who's on tonight.
Hey Jenny, can you check my lab work for me?
Sure, Haley. Hey Haley, you want to tell them what we're doing?
Okay, so we have a triple check with any labs that get sent on our patients just to make sure that everything's correct and that we have the correct amount of employee verification with the lab work.
And it is looking like you have everything perfectly done. I see blood bank sticker, so there'll be no resticks if we need blood products. So everything looks good. Thanks, Haley. All right, Queen, we got you enthroned. How you feeling?
Feeling good.
Feeling good.
Feeling
All
really
right,
good.
babe. Let's bring on that pressure. We want that baby. All right, to the OR we go. Okay, so I'm just going to kind of show you around a little bit. First, this is our PACU. This is going to be where you'll go after you deliver your baby. So we have like 2 areas where there's stretchers. Typically, we only have 1 patient in here at a time, but if we need to, we'll put 2 in here. And then as you go down here, we have OR2, and then we have OR1. We're going to go into OR1 real quick just to make sure that everything looks good in here, okay? So I walk in here, I like to make sure that we have packets ready to open, that anesthesia's kind of been in here and got their own little setup going, and then I always check the warmer to make sure everything's working in here so that I can let nursery know if they need to come in and do something extra. Almost forgot my 3rd code card. I'm going to go do my 3rd code card and then I'll be right out. Hey, Mama.
Hi.
All right, girlie. I hear a lot of pain, a lot of discomfort.
Yes.
Okay, let's get your baby back on the monitor.
Okay.
All right? It's okay, girl. You good. So now we're just reliant on our epidural. Okay, but remember, you know, pressure is normal, pain is not, okay? Talk to me. You feel like it's more like pressure?
I feel like it's just a lot of pressure.
A lot of pressure. Okay,
Yeah.
so pressure's good. So that's going to help us deliver. Sure. It's all right, Mama. Do you feel like you feel baby moving down more? Okay, do you mind if I check you real quick? I don't think so. Okay, let me check you real quick, okay?
It's painful. It's
Okay.
not pressure.
I know, honey, I know, and I don't want you to feel that pain, okay? We need to try and get that under control.
The button, please.
Yeah, there you go. Okay.
You got this, baby. You got this.
You're doing amazing.
I'm doing good, baby.
Once we get towards the end, man, things just roll, especially when your body starts to remember what it's doing with this whole labor process. Oh, yeah. That baby's right there. So, Mama, now let's talk about when Amy does come in, okay? Sorry, I have to get your baby back on. All right, so you remember last time, the way that we push is with every contraction, you take a deep breath and you bear down your bottom to the count of 10.
Okay.
You do it 3 times with each contraction, okay?
Okay.
I'll start counting for you. If I realize that counting for you does not work for you, we'll just tell you push, 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 and then we'll say, okay, take a deep breath, and again. So you'll do it at least 3 times with each contraction, okay? Woman of the hour, let's go.
I'm so proud of you.
Yes.
You got it.
Good job, Mama. So,
You got this, girl. Hang in there. Nice deep breaths.
you feeling one?
All right, my
All
love.
right, let's do it. Chin to your chest and push. Chin up. Push, push, push. Curl. Good. Push. 2,
Right
3,
down here. Push.
4,
Come on. Little more, little more.
5,
You got it.
6,
You got it, babe.
7, 8,
Oh
9,
my gosh.
10.
Right
Good.
back, love.
Oh
Deep
my
breath.
God.
Hi, Mama.
And you're going to cut right between my fingers. Right here. Ready?
Right here?
Yeah.
Yeah.
Nice and easy. It's a little chewy. You got it. Go ahead. Perfect.
Yay! All right. All right, now we're just gonna put a hat on to keep baby warm, okay?
Oh my gosh, thank all of y'all so much. Y'all are
Yes, of
blessings.
course.
Oh my God.
Can you lift up your bottom, love? There you go. Perfect. Come on down. Oh, come to Chesapeake.
Look, Mama. See, Mama, now was that so bad?
No.
You'll do it again and again, right?
Do it again.
You're so cute.
Do it again.
Okay, Dan. Okay, Dan. Okay. So this has been a very long and eventful, fun day, like all the days on labor and delivery. I just gave a report to our night shift charge nurse. We have completed, 5 deliveries today, 5 vaginal deliveries, no C-sections. And we have had a great day. I feel like we've had successful delivery that you guys got to see. I hope that you guys enjoyed it and got a little bit of education on the way to that delivery. And this was just one of those great days as a labor and delivery nurse.